Tonight, I'm Dr. Magaziner and founded the Magaziner Center for Wellness, and some of you I know and some of you I don't know, so hopefully we'll get to know each other a little bit. Anyhow, so tonight we're going to mainly discuss what's called our integrative approach to cancer, and unfortunately, cancer is running rampant in society today. Statistics are that 1 out of 2 men will develop cancer at some point in their lifetime, and 1 out of 2.5 women will develop cancer at some point in their lifetime. So, unfortunately, the statistics are pretty grim, and we're close to 40–45% of the population will be diagnosed with cancer at some point in their lifetime. These numbers are not, unfortunately, getting better. They're not any better in the last 50 years or so, and we've had this war on cancer that, if you remember, President Nixon mentioned back in 1972, and unfortunately we haven't really conquered cancer, and we're still looking for better and better approaches and what we can do. So what we're going to do tonight is talk about our support program. I'm not saying our cure program, I'm not even saying the words our treatment program. It's our support program, and how we can best support a person who's been diagnosed with cancer, but more importantly, of course, our focus should really be on prevention in the first place, because once you have cancer, it's not so simple to get rid of it, no matter what means you use, but we can support your body so that we can manage it fairly well. And we see many, many patients in our practice here, I've been here for over 30 years now, who've been diagnosed with cancer and other ailments, and many of them do quite well, and we manage the conditions using as natural therapies as we can in this office. We know that there's many medications out there that people can get. We prefer not to use that kind of approach in our practice. We'll talk a little about that. We're not saying we're not against it or anything like that, but this is not what we're doing here. We're trying to use things that are supportive and complementary to your own body's physiology and your own health, basically. So I've been researching and doing quite a bit of reading and working with patients over the last 10 years now, specifically on cancer therapies. I go to anywhere from 4 to about 6 to 8 sometimes conferences a year to learn more and more, because we always can learn more. And even what we speak about tonight is just going to be the tip of the iceberg. It's certainly not going to, give you everything you need to know, but I'll hopefully whet your appetite and give you a little overview of things. We have, and we'll take some questions afterwards, of course, and deal with that as well. So here we go. So first of all, so why are we here? Well, tonight we're going to talk about cancer, and other nights we could talk about other conditions, but I want you to realize that nearly 600,000 people die every year from cancer, unfortunately, and it's not too far behind where heart disease now. Heart disease, about 614,000 people die every year. So cancer is the second leading cause of death in the United States, and we need to find better solutions. The current methods aren't working so well, even though we've been told that we have great methods and great cures. They're really not doing as well as we would like. So, and the other thing I think is very astounding here is medical errors, and also, yeah, you're all shaking their head. Nearly 250,000 people die every year because of medical errors, and also pharmaceutical agents, the proper use of properly prescribed pharmaceutical medications. So these things are not benign, and we have to all understand that they shouldn't be taken lightly. And so I think it's very important for us to look for other solutions for all different kinds of chronic conditions. So there's the 4 major cancers that many of you unfortunately have heard of: breast cancer, lung, prostate, and colorectal cancers. And as I mentioned about 1 million people a year are diagnosed with cancer, and approximately 600,000 almost now might die from cancer each year. And many of these, the key is, many of these are preventable. Not everything, but many of these can be preventable. And I believe that it's our lifestyle, what we've done with our diet now over the last 50, 60, 70 years, all the chemicals we get exposed to. We'll take a look at some of these things too, just on this. So these are some of the different causes. Etiology is a medical term. It means causes of cancer. And so, as you can see here, there's a lot of things. But first of all, our diet and nutritional deficiencies can play a big role. 60% of the American diet is generally sugar, processed foods. And now you can add in things like genetic modifications of foods. You've heard of GMOs, many of you, and it's down here on the far right. But anyhow, so this is one area that's really a problem. Over the years, our food has become devitalized, depleted, bleached, transported. It's lost a lot of its nutritional value compared to what our great-grandparents perhaps ate back many years ago. But also, other problems are that there's more and more environmental chemicals now than ever before. There's over 85,000 chemicals in the environment. Many of these we know are carcinogens. So give you an example, things like dioxins, and there's many, many more. And we know that many of these are what we call enzyme inhibitors and something called mitochondrial inhibitors too. So they disrupt the normal physiology of the body. And when you do that, nature is not meant to do that. And so we have to understand that we have to do our best to try to avoid many of these chemicals, things like pesticides, herbicides, heavy metals like lead, cadmium, nickel, arsenic, all those types of things, aluminum, because they're simply inhibiting our normal physiology, and it can cause what's called damage to the DNA, and when that happens, we're more susceptible to cancer. So all these things here can cause oxidative damage, damage the oxidative stress, damage the mitochondria, which can cause the development of cancer. And believe it or not, like the genetic mutations probably only accounts for 2 to 5% of all cancers. So it's not like we inherit these things too often. We've heard of the BRCA gene. That is an example of a genetic mutation that might contribute to cancer formation. But most of the time, 95% of the time, it's not due to what we were born with, is what I want to stress there. And there's many, even like electromagnetic fields, the far right there, with high tension wires. We're all walking around cell phones on our bodies today, right? So I know a lot of it might be controversial, and some say, oh, it's no problem. Some say it's a big problem. Regards to that, we're exposed to energy forces that we've never exposed to in the history of mankind now, in the last 50 years and whatever. We're also, most of us, drinking out of plastic bottles for the last 50 or 60 years, right? And those bottles frequently have something called phthalates in there, which are also troublesome and may contribute to cancer. So, when we were kids, most of us remember the milkman coming to the house and buying milk. It was always in a glass bottle, right? And even though I'm not advocating drinking Pepsi and Coke and things, they were in glass bottles back then too, right? They were in glass. You won't find that anymore too often. So anyhow, we have to be aware that there's many chemicals we come in contact with, but also infections, parasites, chronic viruses, bacteria may also weaken the immune system and contribute to cancer formation. So we all know that there's 3 major standards of care in our society today for treating cancer, right? So it's surgery, chemo, and radiation. We all know they're terrific, right? Well, no. Of course not. No. All right. So I'm going to show you some evidence today and discuss a little bit with you why these things may be troublesome in many cases, but there's things we can do about it to make them less troublesome. So I'm not sitting here saying, or standing here saying, never have chemo, never have radiation, never have surgery. I'm not saying that. But if you have these modalities done, there's certainly things you need to be aware of so you can improve your chances of remissions, maybe cures, maybe turning it into more of a chronic disease, the cancer into chronic disease, instead of an acute illness. And I believe one of the major things we should try to do is turning the disease of cancer into more of a chronic disease, because it is possible to live with cancer. Most of us don't die from the primary tumor. We die from the metastasis of our tumors, which can cause end organ damage, such as kidney failure, liver failure. And we also die from infections. One of the major things that people die from with cancer is infections. Lung infections, right? Pneumonia, peritoneal infections, peritonitis, and various others. Another major reason people die from cancer is when they get chemotherapy, there's a higher risk of blood clots. And blood clots are one of the major causes. Also bleeding in general. The opposite of blood clots is hemorrhaging. So you're much higher risk for these conditions when you're receiving some of the conventional treatments. But you don't usually, unless it's causing obstruction, you don't usually die from the cancer tumor itself. It's the effects that that tumor is now having on the rest of the body, and a lot of more systemic effects. Okay. So unfortunately, the statistics, as I said, the numbers of people being diagnosed today is as much as ever. And unfortunately, the results we're getting aren't so great. So people that have what we call stage 4 chemotherapy resistant tumors, meaning they failed chemotherapy already, she's shocked. But anyhow, so it doesn't mean it's you. It doesn't mean that it's going to happen to you. The key is let's try to manage this so you don't have to become a statistic in that variable amount of time. So you can read that on your own, but you can see here, once you fail chemo, and if you're stage 4, which means it's spread outside the major organ, our survival rates for the masses is not so great. And that's the reality of it. So what I believe we can do here, too, is to increase survival time. also increase survival, not only survival, increase quality of life. So even though those statistics might say for some things 3 to 6 months, for example, or 6 to 12 months, I really believe we don't put enough emphasis in our society on quality of life. So it's not just how long we survive, it's do we have quality? Are we laying in bed and we have no quality of life? Are we in and out of the hospital because of infections and blood clots? Well, that's no fun. But if we can have a decent quality of life, and even if it's 2 years, 3 years, 4 years, 5 years, you know, unfortunately, the fact is we're all going to die someday. But if we can have decent quality of life, I think that should be a major focus of our therapies. And I think with conventional treatments, they don't really discuss with patients enough, and they don't keep enough statistics. How's your life? How's your lifestyle? Are you able to play with your grandchildren? Are you able to see your children? Are you able to go to the movies and have a good time with your spouse? You know, these are really important aspects of any kind of chronic condition, but particular cancer. So we all think that chemotherapy is, you know, a wonder drug, but is it? So it turns out chemotherapy may only improve the outcome of cancer outcomes by about 2%. So it means that 98% of the time, it's probably not helping very much, but yet it's used very frequently. Now, I know there's a new class of drugs called immunotherapy. We'll talk about that briefly too. But anyhow, so chemotherapy only improves the 5-year survival time in adults by about 2 to 2.5%. And one of the researchers said very clearly that chemo makes only a minor contribution to the 5-year survival. And to justify the continued funding and availability of drugs used in chemotherapy, a rigorous reevaluation with a cost effectiveness and impact on the quality of life is urgently required. This was written and studied and published 14 years ago. But even till today, you know, this is not emphasized enough. What is your quality of life? And does chemo truly help? Or is it just, you know, does it really help the survival or not? So, as you know, it's a big business today, and there might be a disconnect between what researchers are really finding and what the patients are really finding. It's very nice for some doctors. I had someone this past week in my office, and she was going to start chemo from her oncologist, and her oncologist said, you know, this should help you. And I said, did he tell you he's going to cure you with it? She said, oh yeah, he said it wouldn't be a problem. She's stage 3, she has lung cancer, and I think they're sometimes painting a false picture because it's much more complex than that. So many of you have seen a commercial on TV. There's a whole new class of drugs called immunotherapy, and they'll say to you, oh, this isn't chemo, it's immunotherapy. It doesn't affect you like chemo will. Well, is that true? So fortunately, for some cancers, it might cure it, which is terrific. The problem is that over 50% of the time, people may have significant side effects to it, to the point where within 6 to 12 months, may actually cause end organ damage and failure. So it may actually do more harm than good sometimes. And when the drug called Opdivo was studied, and it's been now approved for lung cancer, well, what did they really find? They found that it only improved the outcome of the survival of the patient by 3.2 months. So these patients are going through extremely expensive, I was going to say multi-million, but we might get up to that. These drugs are very expensive, by the way. They are anywhere from $100,000 to probably $250,000 for a course of these medications. I recognize the insurance may cover much of this, but in regards to that, we're talking very expensive drugs. And, you know, and is it really helping the survival? Well, 2 months, 3 months. And during that time, we don't know anything about the quality of life of these patients. They don't tell you that. And I would suspect that some of these people aren't having the greatest quality of life. Some of you remember the football coach at Penn State, Joe Paterno, who, about 5 years ago now maybe, he was fired after his incident with one of his assistant coaches, and he was fired. He was 85 years old at the time, and they said to him, Joe, you need to go to a doctor. You haven't seen a doctor in 40 years, but she lived and breathed football. So he said, all right, I'll go to the doctor. Went to the doctor. It was like in August of that summer, and it turns out, they said to him, oh my gosh, you have lung cancer. And he did. You know, he went for a chest x-ray for all these tests. And they said, oh, you need to start chemotherapy right away. Well, he was in and out of the hospital for the next 2 to 3 months, and he died 3 months later. And the newspaper said very clearly, he died from the complications of his treatment. Now, I would speculate, this is pure speculation on my part, it's not scientific, that had he never gone to the doctor back then, right, and he never knew that he had cancer, he probably would have lived more than 3 months, and probably would have had better quality of life during those 3 months. So, once again, I'm not trying to say never do chemotherapy, because we're going to show you some other things that you should perhaps do while you're receiving these kinds of potentially toxic therapies. And my complaint is that rarely does your oncologist or radiation oncologist explain that they have to do other things to support your body at the same time. Because just to pour, chemicals in the body, it's going to kill not only the bad cells, but it's also going to kill the good, healthy cells. It's going to disrupt normal immune function, to the point where your immune system won't work as well anymore if you continue with just medications and nothing more than that. There's a new drug also in the category of these immunotherapies called Keytruda. Many of you have seen it, also maybe on TV. And they said, 71% of the people were alive at the time of, quote, follow-up, whereas when they gave them they compared it to chemotherapy, and they said only 58% of the people were alive who received chemotherapy at the time of follow-up. And then, but they didn't mention in the ad, is the fact that the follow-up was only about 11 months. So once again, it's a very short time period for what they're really looking at. And if a drug shows improvement, survival rate for only 3, 4, 5 months, it's on the market. The FDA approves it. The drug companies will love it because they make millions of dollars, of course, and billions probably. And but very few times it's very important if you talk to ask your doctors, what will this drug do for me? And what have the studies truly shown about it? And what has it said about my survival time and my quality of life? And we're missing out on those kinds of things. The drug companies don't give the patients or the patient's family enough information to truly make a reasonable decision. That was one of the quotes from an MIT researcher. So, here's another study. It just came out 2 weeks ago. It came out in Nature Translational Medicine. It's one of the medical journals that we get. And first of all, they pointed out and they said, doctors have always wondered why when a female has, this was on women, this study, has a breast cancer, a biopsy, a lumpectomy, or a mastectomy, why do they see so many recurrences that come back 12 months, 18 months later? And by the way, recurrences is a major problem with cancer in general. Probably over 50% of people that I see in my practice upstairs, they're here because they've had a recurrence of their primary tumor. Okay? But anyhow, so the question is why there's so many recurrences, at least in this case, on breast cancer. And what the researchers found is that the actual healing of the wound after a surgery, so it's not the surgery itself, but the healing process of the scar now is very pro-inflammatory. And by doing so, you've lost what's called the inhibition, because some of the cells, cancer cells, can begin to wander away from its original tumor site. And the immune system now no longer has that break to stop the cancer from spreading. And so unfortunately, they're saying that without the break, the cancer cells are free now to grow and to become even a more dangerous tumor. And when there's recurrences, we know that they're more difficult to treat, unfortunately. And because part of it is because people have already gone through the traditional treatments the first time and they haven't done so well, to try to treat it a second time is just much more difficult. So they're saying that the post-surgical wound healing may actually stimulate so much inflammation that it may actually partially trigger the spread of the cancer. But it's not because necessarily it's from the surgery. So when you talk to your doctors, it's the inflammation that's caused by the healing process actually of the scar, and also it's the loss of restraining the cancer cells from wandering away from the initial site. Now, there is a little bit of good news here, and that is when they gave people anti-inflammatory medicines, such as ketorolac, which is an anti-inflammatory, around the time of the biopsy, or around the time of the lumpectomy, those women were 5 times less likely to have recurrences compared to those who did not get the ketorolac, which is the anti-inflammatory. So the use of anti-inflammatory agents might be wise if somebody's having some kind of biopsy, lumpectomy. Now this is all preliminary data, and in fact much of what we're talking about is in here tonight is still very preliminary. And we do not have all the answers. I need to tell you that. You know, we're looking at different studies are out right now, but this might be an area where doctors will start using many more anti-inflammatories when they're doing biopsies and other surgical procedures. Now, another thing I want to bring up, I'll bring this up later. But, so, what we therefore have been doing now is, I've been practicing an area called integrative oncology. And I'm not an oncologist, I'm not pretending to be an oncologist. But we try to use what's called integrative medicine to try to treat and heal our patients as best as possible. And because the results we're seeing in traditional medicine are, you know, it's not doing what we had hoped. So what is integrative oncology? It's looking at the whole person and how we can best address their healing, what you call it, their healing platform. So it's looking at the whole person, first of all. So it's not just looking at the tumor. You know, too often in conventional medicine, they look at the lump here, lump here, lump here, and they say, oh, we have to treat that, we have to kill that. Well, you're a person. You're not a lump or a bump in the breast or the prostate or the colon. And so you have to look at the whole person. And cancer is a very systemic problem, which means that there's inflammation going on throughout the body. There's different messengers that are liberated or secreted by the tumor cells that begin to send messages elsewhere in the body. It's important, I believe, that the patient and physician have to work together, because it can't just be, it doesn't work well when it's just one-sided and they you know, if someone says this is what you have to do, or the patients are never going to do these things. It has to be a joint effort most of the time. And you can't neglect all the other aspects of a whole human being. And that's the spirituality, the emotional aspect, exercise and activity, the immune system, good nourishment, good nutrition. I'll show you more things about detoxification, things about your lifestyle, and there's various targeted cancer therapies that may be useful. So the goal for the integrative oncology is really to thriving while surviving. So we want to thrive in life no matter what we have wrong with us, whether it's diabetes, headaches, high blood pressure, heart disease, or even cancer. We want to feel as good as we can because, you know, everybody sort of comes down with something. I'm not saying cancer, but something at some time that's not so pleasant. We catch a cold. We want to thrive even when we get rid of these colds or whatever we have wrong with us. So, and I believe that turning cancer from an acute condition to a more chronic condition is very important as well, and that's truly what we're trying to do as well. By the way, I'm going to show you a few books at the end. Well, one was written by a friend. She became a friend of mine. She wasn't. I didn't know her at first. And over here. So anyhow, she wrote this book called The Healing Platform, and her name was Annie. She was diagnosed with stage 4 breast cancer about 16 or 17 years ago. And they told her to get her affairs in order, and they didn't think there was any chance of her surviving. Well, it turns out she's alive today. Did you meet her? You're shocked.
No, I just read her,
read her books.
some of her book today.
So it turns out she has been doing very well overall. She still has cancer, but yet it's 16 or so years right now, and she is thriving. She has put together a medical organization that's training doctors on how to deal with how to work with integrative oncology and how to best address the whole body. So, for example, in 2 weeks from now, I'm going to the meeting again. I've been going for 6-7 years by now. And by the way, if you want more information, I can get you that as well afterwards, because it's open to the public. But it's in Orlando, Florida. And it's the weekend of May 16th to 19th, 17th to 19th.
Is she a doctor?
She's not a doctor. She's a lay person that's just organized these meetings now of physicians that come and speak. There's about 30 lecturers, and there's about 300 attendees. I'm just one of the 300. And that's how we learn so much, because she brings in speakers from all over the world that give presentations, and these are scientific, rigidly sound presentations. And they show data on various nutritional therapies, holistic therapies, all kinds of things you can't imagine, but how these things have been beneficial to patient outcomes. So they're not saying they're curing cancer or anything like that, but patient outcomes is crucial. So anyhow, when we're dealing with integrative oncology, we have to realize that cancer is a systemic condition. It's not, as I said earlier, not just that lump or bump that we need to address, which is traditionally what's being done. But yet, we have to understand that there's great inflammation that can cause cancer to thrive and to grow further. There's also what's called tissue hypoxia. It means that the tissues with cancer are very unique. Our healthy tissues they thrive on oxygen for energy. But a cancer cell thrives on glucose for energy, and they thrive in an anaerobic environment. Anaerobic means their metabolism does not require oxygen at all. It's a very unique system. And they don't make the same amount of cellular energy, it's called ATP. They don't make the same amount of cellular energy in a cancer cell as a healthy cell does. So they lack energy. They have a low, what's called polarity, a low, it's called energy potential compared to healthy cells. So the bottom line is they act very differently. And their biology and their physiology is very different from a healthy cell. And therefore it needs to be addressed differently than a healthy cell too. But anyhow, also there's work out of University of Boston University, Dr. Thomas Seyfried, S-E-Y-F-R-I-E-D, PhD, biochemist, and he has shown that cancer also involves problems with the mitochondria. Anyone ever hear of mitochondria? Yeah. Good, you guys are good. So mitochondria are little things inside our cells. They help us make cellular energy. They're so important that we have thousands and thousands of these in our body, and 10% of our body weight is made up of these mitochondria. So if you weigh 150 pounds, 15 pounds approximately are these mitochondria. Without good mitochondrial function, we cannot get rid of cancer very easily at all. So that's an area that we also focus on, the different therapies we use here to try to work on all these areas. And the other thing is the immune system, as I threw out earlier. It's vitally crucial. It's one of the areas that is probably neglected quite a bit in conventional medicine, but it's an area that we pay close attention to, because without a strong immune system, your body can't fight that well. So we do special lab tests here, and we look at aspects of how well your immune system is working. So there's various tests that we can do for that. So some of the treatments, we do all kinds of, I don't want to show you more about this, nutritional things, lifestyle, detoxification, mind, body, spirituality are just some of the things that I think are very important. And we see cancer as a systemic disease I mentioned, but also it's like a wound that doesn't heal well. So that's why, cancer, one of my colleagues said to me, patients often say to him, hey, can I eat junk food on Saturdays or Sundays, or pick some day of the week to eat crappy stuff? And he said, you know what? Cancer doesn't take a day off, unfortunately. We'd love it to. We'd love to say, oh, you know what? Yeah, it's fine. Go eat what you want. No bearing on anything. The problem is that's not accurate, and it's kind of like a wound that's not healing well. So it kind of stays with us. And it outsmarts us. It evades the immune system. The cancer cells are very smart. They change forms, and they evade the immune system. And that's why it's so difficult to treat. So we have to try to change the behavior of the cancer cells. So now these are some of the areas that we work on in various aspects of our care. And we have to change what's called the terrain. We have to manage the terrain of the cancer cells. And so, for example, cancer cells are much more prone to blood clotting. I mentioned that because cancer is a hypercoagulable state. Hyper means too much, right? Coagulation means the bloods are clotting. So that's just one example. We have to manage the blood clotting. We have to look for we have to try to inhibit angiogenesis. What does that mean? Well, angio means blood supply and blood circulation, right? So the more that is generating to a cancer cell, the worse that is. So there's things we try to do to inhibit blood supply to tumor cells to try to shut that down. We have to modulate all these different areas. We have to control infections. We have to try to stimulate something called apoptosis. Anyone ever hear that word? No, not much. So apoptosis is the medical term for what's called programmed cell death or cell suicide. So we want our cancer cells to commit suicide, right? Because even our healthy cells, by the way, healthy cells die off too, but they're supposed to. Like a red blood cell lives for about 120 days. But a cancer cell doesn't know how to turn off. That's part of the problem with it. It just keeps generating, and multiplying. So that's where we have to change the behavior and the activity of cancer cells if we can. So and we have to also regulate blood sugar when we're fighting cancer, and I'll show you a slide about that soon too. But it's very important to keep your glucose levels down when you have cancer. If you think of what a PET scan does, it's a test that doctors sometimes order, and they have you drink a glucose solution they call contrast, but anyhow, it's a sugar solution, and that's what they see on the results when the sugar gets taken up, let's say in the brain. is because the cancer cells are sucking up that glucose in the brain or in the lungs or somewhere else. So that's just a little simple practical example, but we have to lower our glucose levels as best we can and stay away from sugar refined processed foods in order to prevent cancer if we can, and number two, certainly try to address it and manage it. So it's very important we detoxify our body because I said earlier there's tons and tons of chemicals we get exposed to, and this is one little study that was published a while back, not too long ago, about 5 or 7 years ago, and they just looked at these are newborn babies, all right, and they looked at the cord, the umbilical cord, blood, and they tested these for chemicals. There was over 287 toxins that were identified in the umbilical cord on day one, on hour one. 180 of these which might be potentially carcinogenic. So we're wondering why, we're seeing all this cancer. I'm saying this is just another reason, is that we're exposed, we live in a chemical soup today. We're exposed to things that never existed 50, maybe 100, depending what it is, years ago, and in greater quantities than ever before. So I'm not only exposed to the chemicals, the quantity is unique, and we've never been exposed to these things ever before, and our body doesn't know how to handle it. Our immune system doesn't know what to do with it. Our detox pathways are clogged up by all these things. This is some recent literature showing that there might be an association with cancer and heavy metals. So you might be thinking, heavy metals, I'm not exposed to that stuff. What are you talking about? I don't work in a paint factory. Well, it turns out that over 3,000 municipalities in the United States have excess levels of lead in them, including Philadelphia, by the way. So it's very important that we start thinking about the water we're drinking and that we start thinking about filtration of water. But it's not just that. There's other things too, even this doesn't have any mercury here. But anyhow, arsenic can be found sometimes trace amounts in rice and I think apples, and because it gets into the soil from all the contamination throughout the country, really. But now, so if you look here, you can see there's a higher risk of esophageal cancer if you have high levels of lead, higher risk of lung cancer if you have too much copper in your body. Brain tumors may be associated with high levels of arsenic. And bladder cancer, cadmium, breast cancer, cadmium. By the way, for breast cancer too, and this is an observation that many doctors have made, I don't know there's papers on this, but having root canals in the mouth, there's what's called a meridian, according to Chinese medicine, between our teeth and the breast meridians. And so we've seen in patients, it's just an observation now, that, like, I talk to some of our patients, with breast cancer, have you ever had a root canal? And they'll say, yeah, I had one right here on my left side. And then more likely to have left-sided breast cancer versus right-sided in that example I just painted. So there's so many different things out there. And because root canals, by the way, it's the only time that we leave dead tissue in the body. In other words, if you have a gangrenous foot, usually you don't just leave it. The doctor typically does surgery and does what he has to do. But with root canals, you're actually leaving a lot of dead pulp and it's a whole other area. Anyhow, so chronic exposures to chemicals, which enter the body through the food chain, can increase the frequency of certain cancers. So, and there's actually a lot of scientific evidence about heavy metals and cancer. This is not something that's speculative. There actually is good research on this. Now, what do you do if you have high levels of lead? Well, they've done studies showing they took people who live in an area that had high traffic zones. This was in, wasn't here, it was in overseas. I think it was like in Sweden or Switzerland or something like that. And they measured their lead levels. But what they did is those who lived in a high automobile area versus those who lived way out where there weren't too many cars, and they compared those people, those populations. And they treated them with something called EDTA chelation therapy, which is a binding agent that helps bind onto metals to help you excrete it. And what they found that 59 of the patients who were treated in the high traffic zone, only one of those people died from cancer. And this was I think an 18-year study. Only 1 out of 59 people who lived in a high traffic zone died from cancer. But yet, those who did not get any kind of chelation therapy and therefore removal of lead and cadmium and nickel and arsenic, which is, it removes all that stuff. 30 of those people died out of it was like 172, as I recall, because the total was like 237 people that they studied. Anyhow, they concluded that by giving chelation therapy to people that had lived in an area where there's high lead exposure, there was a 90% reduction in cancer deaths in those who received the chelation therapy versus those who did not receive the chelation therapy. So it might be an area, so it's one of the areas when we do an assessment on our patients, we look at heavy metals in the body, we check to see what's your lead, cadmium, nickel, arsenic like. What is your immune system like? What about your nutritional value? You have low levels, high levels of things? You know, so all these things are crucial in order to treat the body as best as we can. Whereas, you know, most conventional settings, you won't hear anything I said yet, pretty much, right? I mean, this is very different from what you've been told by your oncologist probably. I'm not against oncologists. It's just we need to think outside the box a little bit and utilize a whole person approach, okay? So we know that if we're overweight, you know, there's greater risks, if we're obese, I should say, there's greater risk of various cancers for men and women, but women actually are more susceptible to various cancers if they're overweight. And it is possible to reduce your risk of developing cancer by eating a healthier diet. We're not going to get into that today as far as dietary stuff, but this came from MD Anderson. So even they said that perhaps we could reduce our risk by eating a healthier diet. You know, are they practicing that kind of medicine? I don't know. But some of you may have been there and you know better than I would. But anyhow, and also I mentioned sugar a few minutes ago, and I know your doctors probably say, you know, we'll give you Ensure, it's fine, it's good calories, right? Look at the first couple ingredients, they're sugar, right? So, and so the rest of it's stuff that's all chemicals, by the way. So, anyhow, we know now, there's plenty of evidence showing, and your doctors will argue this because they don't want to read this stuff, that it's more troublesome if you're eating a high sugar diet. It signals certain messages in the body to increase the risk of breast cancer development and metastasis. So you're more likely to get metastasis if you're eating a high glucose, simple glucose diet, meaning a high sugar diet. You know, cakes, pies, ice cream, donuts, sodas, all that kind of stuff. All right, so next section I want to talk about a little bit is immune support. So I kind of mentioned that the tumor, what's called microenvironment. The tumor environment is very, what's called heterogeneous, which means, let's say you have a tumor the size of a baseball. The whole baseball is not the same, the cells are not quite the same as each other. And it turns out that some of those cells in that baseball could be not so harmful, not so virulent, not so dangerous, whereas other cells within that same baseball could be very troublesome for that same person. So the cells act differently from one to another. They're all not the same. Anyhow, so usually you can't develop cancer unless the microenvironment, the environment of the tumor, is hypoxic. So it's only when the oxygen content drops quite a bit we can develop cancer in those cases. And this was studied, and a doctor won the Nobel Prize for this in 1932, nearly 85 years ago now, when he showed that evidence that cancer primarily grows in a hypoxic environment. Okay, low oxygen means. Therefore, oxygen might be something that we should think about, perhaps, to help improve cancer outcomes. We also need to increase, our nutrients and our fiber in our food. We need to regulate blood sugar. I mentioned reducing the toxic exposure through food and chemicals. And hyperbaric oxygen, by the way, is something we do here too. That's something that increases the oxygen content in your body. And pretty harmless stuff. And there's some evidence showing that it may improve the outcome of patients who have cancer. And we also have to change our mindset. Our mind is extremely powerful in every disease, but cancer is probably one of the more important ones. Because if you don't use your mind effectively, and you should get rid of like resentment and anger, those things will suppress your immune system. You have to have laughter and fun and loving relationships. Those things are vitally important, and they've studied this over and over. You all heard of people whose spouse, for example, dies, and the next year, the wife died, next year the husband died, and vice versa, or vice versa. We all hear these things where you have a terrible emotional stress of going through divorce, and all of a sudden, within months or so, cancer develops. And you're like, what's going on? Well, your immune system is weakened by that emotional stress. I had someone today in my office, she wasn't here for cancer, but she told me she's going through a custody battle right now with her ex-husband. And, she's feeling horrible now. Many different things happened all of a sudden. But she felt fine before that. But this is real. Carol, can you turn the air up a little bit? Make it colder? Anyhow. So, there's various immunotherapies I mentioned coming out. I threw out the name of two of them, Keytruda and Opdivo. They're certainly not ideal for the reasons I pointed out as far as the real statistics behind them. But they're coming out all the time. But the other thing is that a lot of these chemotherapies, they're only helping about 10% of all the cancer patients. That's it right now. Maybe it'll get better as time goes on. We don't know. But, and people are having a lot of what we call end organ damage from them, sometimes 6 months, 8 months, 10 months later, to the point where they're running to kidney failure, liver failure, develop autoimmune diseases, and some of them are dying from it. So it is helping quite a bit with about 10%, but it's very hard to identify, who are those 10% that might have a great result from it. That's with everything, really. It's very hard to identify it. So I mentioned a little bit about inflammation already, but there's many ways. You're all familiar with the term inflammation, and it can cause heart disease, it can cause arthritis, anything with the end itis means inflammation. But cancer is also something that the cancer metastasis is something that inflammation can also contribute to. So it turns out within the cancer cells, I'll get to that in a minute. But anyhow, here's some of the sources of inflammation. Many of these you're aware of, but some of them you may not be. Even stress is an area of contributing to inflammation. They've done studies where they measure something called inflammatory cytokines. These are certain components of our immune system. And they've shown when college students intentionally are stressed for a final coming up, a midterm coming up, that they make more of these inflammatory cells. So stress is one thing we have to be aware of. But bacteria, viruses, funguses, all these things can add to add to our stressors and inflammation. But we can help to regulate some of those inflammatory responses by our lifestyle. But we have to be aware of what they are and what we need to do. These are some of the botanicals that I have frequently used that may help to reduce inflammation. So these are typically things that you have to purchase somewhere. They're not. You can get some of this. Not really. A little through plants. I was going to say. They're plants, but you have to usually purchase these things. They're tinctures. They're capsules. They come in different forms. But there's some, for example, some of you heard of curcumin. It's a component in turmeric. I'm going to show you a slide on that soon. It's an Indian spice, Indian herb. It's a wonderful agent to help reduce inflammation. It may have beneficial effects against cancer as well. Berberine is also a form of golden seal, which is also an herb. It has good immune-enhancing effects to it. So there's various things. Now, many of you have been told if you're going for chemotherapy, don't take any supplements, especially antioxidants, right? So you might have said to your doctor, I want to get vitamin C infusions from this crazy guy down the street. So, I'm not talking about me, of course not. But anyhow, you heard that before, that kind of thing?
Every time.
Every time.
With other patients.
Yeah, we hear it all the time. I hear it every week.
No antioxidants.
No antioxidants. So it turns out that most conventional doctors, oncologists, are very much against anyone taking intravenous vitamin C when they're getting chemotherapy.
Why?
Because they say to the patient, it's an antioxidant. We don't want to interfere with chemotherapy because chemotherapy is called a pro-oxidant. We want it to kill sort of the cancer cells. Well, it turns out, scientifically, they are incorrect. Scientifically, when vitamin C is given in high doses, which is what we tend to do, and we give it intravenously, it's not an antioxidant. It is also a pro-oxidant, which means it actually works synergistically with traditional chemotherapy. It works along with it. It actually reduces the risk of side effects from the chemotherapy, and it helps to improve the overall outcome of the patients. It does not interfere with it at one bit. And I always laugh in a sense when I hear doctors, my patients, tell me the doctor told them not to take any antioxidants. I said, well then, you better not eat any fruits, you better eat any vegetables, you better not eat any beans, you better not have any nuts, you better not have any seeds, you better just eat junk food all day then, because they don't have any antioxidants in them. But healthy food does contain antioxidants, and the bottom line is, there's no true clinical evidence that taking antioxidants are going to truly interfere with your chemotherapy or your radiation. It's a completely theoretical concept, and it's never been proven with any true scientifically well-documented studies. But IVC, just to tell you this, is not an antioxidant. So if your doctor tells you can't have, you tell them it's a pro-oxidant because it helps form something called hydrogen peroxide in the extracellular space in the body, and it actually works synergistically along with chemotherapy. And there's a study, I think somewhere here, that the study was they gave IV chemotherapy to, now this is a small study, but to 9 men and women who had advanced pancreatic cancer. They had stage 4, which is not good, pancreatic cancer. And they gave them all high dose of vitamin C twice a week intravenously. And by the way, taking it orally is not the same as taking it intravenously. You can't get your levels up high enough if you take it only orally for where it needs to be to truly have the effect that we're looking for. But anyhow, so they gave it to patients intravenously twice a week, and they gave them, half of them got a chemotherapy drug called gemcitabine, which is commonly used for pancreatic cancer. And then they measured the progression of the cancer and the quality of life. They also looked at their overall survival. They looked at their blood work. They did everything they could do to look as carefully as they could. And what did they find? Well, they found that those who received the IVC, along in conjunction with the gemcitabine chemotherapy, actually had a better outcome and less side effects compared to those who just had the chemotherapy alone. The people that had both therapies together lived approximately 13 months. Those who only had the gemcitabine, which is a chemotherapy, only lived an average of about 5 months. So there was a approximately 2.5-fold increase in survival and better quality of life in those who received both vitamin C IV along with chemotherapy. But your regular doctors probably will never tell you about this stuff. They don't want to hear about it. And these were published, in standard peer-reviewed medical literature. All right? And I'll try my best to tell you when things were truly scientific papers and when it's kind of an opinion on my part. So anyhow. Now, the next area I want to mention is something called cancer stem cells. This is an area that I think is also being neglected or missed by more conventional oncologists. So, there is a subset of cells inside a tumor, a very small subset. It's about 1% of a total solid tumor that are called cancer stem cells. And these truly are the ones that are more virulent, more troublesome, and are more likely to cause metastasis, which means spread to other parts of the body. So that's about 1%. The other 99% of cells in a tumor are called tumor cells, and they are not as harmful to us. They are not as likely to metastasize. They'll stay put, and they usually don't cause as many problems. And the problem is that we need to start looking at and targeting the cancer stem cells if we can, if we're going to truly achieve better results. And when we give chemo, I'm going to show you a couple slides in a minute. I'll show you now. If you receive chemo radiation, part of the problem is they actually resist, the cancer stem cells resist chemotherapy, meaning chemotherapy does not kill cancer stem cells, nor does radiation therapy does not kill cancer stem cells. And in fact, it probably makes these stem cells much more virulent, much more troublesome, and more likely to rear their ugly head and cause problems. So there's a whole physiologic reason why this happens, but it's been well studied now. There's Stanford University, Dr. Dean has been studying this. At Michigan, Dr. Max Wicha has been studying this for quite a while, over 10 years now. And there's work out of Dr. Haber is somewhere else. I can't think where it is right now. I'll find it this slide. But anyhow, so we need to truly start addressing and looking at these cancer stem cells if we're truly going to have better outcomes. And the key is that standard chemotherapy, standard radiation actually make them more virulent, more worse than before. And these are the ones that spread, and they're the ones that metastasize. Now, there's all physiological reasons why this happens. So now, chemotherapy, they said right there, chemotherapy radiation makes cancer worse. And that came from Professor Max Wicha at University of Michigan. And when discussing potential targets for the treatment of cancer today, the conversation will generally lean towards targeted therapy or should be leaning towards cancer stem cell therapies. And that's Dr. Dean from Stanford. Now, another problem is, I hope most of you can see this, you may not be able to,
No, I can see.
but if there's a tumor that's like 1 centimeter, so a centimeter is like a half inch, a little less. But anyhow, if it's a tumor that's 1 centimeter, that's usually made up of about 1 billion cells. You just have to take that for a little bit of fact. If we use chemotherapy and we kill, it works great, and it kills 99.999%, I should put a percentage on there. It kills 99.99% of the cells. We're all happy. But here's the problem. That means that about 10,000 cells are still left, right? Because it only killed 99.999 out of a billion. The math, I think, comes out to about 10,000 cells are still left in your body. And those cells, that's not enough cells to be detected on any scan. PET scan, CAT scan, MRI, right? So you're walking around 10,000 cancer cells. Most of those cells now are what's called cancer stem cells. And these are the ones that are much more likely to cause recurrences. That's part of the reason why when people get chemotherapy or radiation, mathematically what's going on, and that's part of the reason why you see a recurrence sometimes after a person has traditional therapies, because there's nothing being done to address these cancer stem cells. And they're the ones that are more virulent, more likely to metastasize and spread. And unfortunately, the patient's told, oh, you're in remission because it's not detectable. And so the patients they feel great, I'm done. So for the next year or 2, sometimes 3, sometimes 4 years, we don't know, they're told they're in remission. But yet, sometimes they find out a year later, months later, tumor's back. And part of it's because these cancer stem cells are floating around, and they become more troublesome to treat each time when there's treatment failures. So even with this math too, if the doctor then says, all right, well, we got to start a new course of chemo. He sees the cancer came back. Well, now the cancer stem cells are more resistant, because I told you that cancer stem cells, in general, they try to evade the immune system. They hide, they change format, they change structures. So now the chemo, they give you chemo, now it won't kill 99.999%, it may kill 60% if you're lucky. So 60% kill that, you're still left with 4,000 of these cells, once again, non-detectable. You're told you're doing great. These cells are even more troublesome than those original 10,000. They're more potent. Okay? So, these are the areas that are not often discussed, but there's a lot of literature to this effect today. And this is just saying that these cancer stem cells, they also thrive when oxygen is scarce. And so, once again, cancer cells can only grow in an anaerobic environment, which means lack of oxygen, and the stem cells in particular thrive during an oxygen-deprived environment. And this was worked on at Hopkins very recently, 2016. And there's other work like this. It's not like he just made this stuff up. But these are some of the different things that I pulled out of the medical literature. So, so the summary is, cancer mortality and death is directly related to cancer stem cells, because these are the ones that are metastatic and more likely to proliferate. Cancer radiation do not kill the cancer stem cells. Chemoradiation might therefore make cancers grow faster and more virulent. And the treatment of people with cancer requires adjunctive various other treatment modalities, and should involve not just chemotherapy, radiation. That's where I'm getting at this integrative oncology, to treat the whole person. So anyhow, we have to start looking at that too, and ways of doing that. So these are some of the important, what's called Nutriceuticals, that we use in our practice. These all have to be, I'm not telling you all to go out and buy all these things or anything like that, but we often use these, and many more, on a case-by-case basis, depending on various factors that we think are best. And so, certain tumor types, certain genetic types may respond better to one thing than another thing. By the way, so I'll just mention a few things about a couple of these. So vitamin D, by the way, you all heard of vitamin D. It turns out it's not just a vitamin. It's actually a hormone that regulates over 2,000 genes in the body, many of which are anti-cancer genes. So it turns out that probably 70-75% of the population in this country is either low or suboptimal in vitamin D. Well, if this nutrient is responsible for affecting over 2,000 genes in the body, we need to make sure our vitamin D levels are sufficient, not insufficient, are optimized. Okay? So unfortunately, when you go to your doctor and you ask him to please check your vitamin D level, the range is very broad. It's from about 30 to 100 for most labs. And if you're 35, 37, 38, 39, 40, your doctor probably says, oh, you're fine with vitamin D. Even at 31, you're usually told you're fine. But it turns out the optimal range for vitamin D is probably around 60 to 80, maybe, in that range. And if you're only at 32, and we could double your level, get up to 64, you might function in a much higher level at that point, immunologically function better. Okay? Plus it has other beneficial effects for various other things. AGCG is a wonderful agent. I'll show you a little bit about that. Anyhow, so these are some of the things that we're using. I'm going to touch on a few of these individually in the next few slides. Some of these you've heard of and some haven't heard of. But that's the thing. We use very unique things here because we research these things. I go to, as I say, conferences, and we try to find out what has some scientific evidence behind them, what has it showed. And these are things that are not well known to most of us, most Americans.
I'm sorry, CBD, is that the
cannabinoids.
medical? Is that the medical CBD?
Yes. Yeah. So I'm going to show a couple slides. So I already mentioned that vitamin D, but also inhibits what's called proliferation of cancer cells and promotes what's called the differentiation. It's extremely important that we make sure that at least your vitamin D level is as optimal as we can get it there. Some people unfortunately have a vitamin D receptor defect, and therefore it's very hard to get the levels up as much as we'd like. So in some cases we have to do injections, like intramuscular injections of vitamin D, because orally some people just don't absorb it well. And there's different kinds of D, and the absorption can be different between a capsule and a liquid and a pill, a tablet, and who's manufacturing it and about the quality of it. There's various factors that play a role. Something called resveratrol. Some of you heard of that one, right? Right. So you find that in, for example, red wine, red grapes. But anyhow, so it also may stimulate apoptosis, which I mentioned earlier. It's that programmed cell death to cancer cells. It may reduce inflammation. It may inhibit some angiogenesis and may inhibit metastasis in the body. So it's a very safe substance, by the way. And there's a lot of research throughout the world on that one. Melatonin, right? Many of you heard of that. It's good for sleep. But it has other beneficial properties as well. It's not just for sleep. It has great immunologic benefits to it. So, for example, it may help to regress the growth of tumors and increase your 1-year survival. It's been shown to help stimulate what's called natural killer cells, which is part of the immune system. And it does something immunologically where it will change something called the Th2 to Th1 cells, which is sort of these T helper cells that we have in our body, which is more favorable when we're trying to fight cancer. So it helps us fight cancer by various immune mechanisms. So it's not just a sleep aid. Commonly, you may have to go to higher doses in using melatonin than what you thought about. Some people, are used to using it for sleep. They take 1.5, maybe up to 3 milligrams a night, and it can help with sleep. But to have the beneficial effect to improve tumor regression, you probably have to use higher doses. And sometimes we use 20 milligrams, and sometimes even higher than that. So anyhow, but there's some evidence that it might help with liver, kidney, pancreatic, breast cancers, lung cancer, etc., because of its overall immune effect. So it doesn't treat any disease, but it may help the way our body functions and metabolism and our immune system. Now, something I became familiar with only about 5 years ago. Never heard of this in my life before. It's called hinokiol. And I was at a lecture where a doctor was presenting his talk, and he's talking up at the podium, and it's like, he's talking about hinokiol this, and hinokiol could do this, and I said to the guy next to me, he's like, what the heck's this guy saying? What's that word? And he said, I don't know. I said, I don't know either. So he kept talking about hinokiol, and I raised, in the middle of the lecture, I was like, stop. What are you talking about? What is that word you're saying? And then he said it, and I said, how do you spell that? And that's how you spell it. So I'd never heard of it, and most people haven't. But anyhow, it's an extract from magnolia leaves, the magnolia root. And magnolia is very soothing. It's very good for anxiety, nervousness, panic attacks. But there's some evidence now that it also may have an anti-inflammatory effect and anti-cancer-like effect. It may have an antioxidant effect. And it also may inhibit something called, I don't want to get into this too much, but NF-kappa B, which is something we make. It's a protein in our body. It's a messenger in our body that's extremely pro-inflammatory. This substance may also help reduce the cancer stem cell proliferation. So that's the stuff I've been talking a little bit about, that the cells that I think are really important that we address. So it's just another novel agent that we sometimes use. There's something else we use a lot called modified citrus pectin. And in a minute, a couple slides from now, I'm going to show you why that can be important. But the trade name of the one that's been most well studied is called Pectisol C. And this is derived from lemons and limes, and it's from the inside, what's called the pits of these fruits. And what they found now is it actually may inhibit an enzyme in our body, a protein, called galectin-3, which, when we have malignancies, commonly this galectin-3 is elevated in the body. And it can cause inflammation, and it can also cause metastasis. The higher the galectin-3 level is, the greater risk of metastasis of these cancer stem cells. So one of the things that we do is almost in everyone, we check the galectin-3 level to see, if it's high, we need to try to bring it down. And the best way to block it and to bring it down is with the use of modified citrus pectin. We use various mushroom extracts. There's a whole bunch. Obviously, this time's going to be an element here. Metformin. Has anyone heard of metformin?
Yeah.
All right, good. So at least half of you are shaking your head. That's great. So metformin is a medicine. So we do use medicines sometimes as well. So metformin is a drug that's commonly used for diabetics, and it works very well for that purpose. But what they found, in addition to that, because it decreases insulin resistance, it may help the outcome of people who have cancer. It may actually, if you have too much insulin in your body, it causes cancer cell growth. So we want to lower the insulin in the body to try to inhibit cancer cell growth. And this is another one that may actually inhibit cancer stem cells. This is one of the few traditional medicines that's actually in the medical literature that might inhibit these cancer stem cells that I said are so troublesome. All right. But you have to be careful with this only because it lowers your blood pressure, the blood sugar, and we don't want to lower it, too much or anything. So we have to monitor our patients who are using this. Low dose naltrexone. Anyone hear that one? So some of you. Good. Good. So we have a very informed group here. Anyhow, so this is another one that we use. This is another medicine, by the way, but we're using it for a different application from how it's used traditionally. But it may also improve the immune response. It may inhibit cell proliferation, cell growth in cancer cells. And it also is very useful, by the way, for autoimmune diseases. So that's another, there's various applications of this substance. This is a prescription, it has to be prescribed, and it has to be purchased typically through what's called a compounding pharmacy. This is a green tea extract called EGCG, and this has a lot of science behind it. There's probably more articles, or as many articles in EGCG as far as herbals and nutriceuticals is probably in the top 2 or 3 as far as science behind it. So anyhow, there's various studies on it because it contains a lot of what's called polyphenols. These are substances with potent antioxidant capability, and we know now that it's various cancer conditions where it may help. So drinking green tea is, of course, very important and very helpful. We sometimes have people purchase a concentrated form of EGCG, which are these catechins, that's what they're called. They found that those who drank the most may have less spread of their cancers and are less likely to develop pancreatic cancer. So, there's different applications for these things that are very important for you to consider. This is an area, you've heard of medical marijuana now today, and the components are called cannabinoids or cannabinoids and cannabis, and in Pennsylvania it's become legal now, and in New Jersey there's some talk about it. This is an area that is booming, and I'm not an expert in this area yet, and I don't know if I ever will be, but it's an area that I'm interested in learning more about, and I'm actually going to a conference in 2 weeks from now. It's like a 3-day conference where they're going to be discussing some of the medical benefits of cannabinoids. But anyhow, so we know that it helps reduce nausea and vomiting and pain and anxiety. A lot of people have cancer and other conditions. These are well-known effects for having cancer, so we can lower these symptoms. And there's some talk that it might be one of the best treatments for cancer, perhaps, but we don't. We're not sure yet. But I will tell you that even in Philadelphia, Jefferson and Penn is now talking about studying these things along with the growers, and trying to have a joint effort. But I think it's an area in the future we'll know a whole lot more about. And it's in its infancy. There's a place right here in Belmar, New Jersey, that's growing it and distributing it in different forms, lozenges and tinctures and topicals and all kinds of things. So, all right. So let's move ahead. Okay, so one of my favorite nutraceuticals for cancer purposes is called curcumin. And it turns out that there's at least 9 different major targets. I know this is a scientific thing, and I'll try to just put it in layman terms if I can. But there's at least 9 or so different major targets for how curcumin might work. And one of the things I really like about this slide is the fact that certain chemotherapies, like some of you may have heard of Avastin or paclitaxel, these are common, fairly common, or Herceptin, you've heard of that one, some of you, for breast cancer purposes. The way that some of these chemos work is by blocking some of these pathways, HER2 receptor, for example, for those who are estrogen positive and HER2 positive, perhaps. But anyhow, curcumin may have a similar effect as some of these chemotherapies. So if we can get away with a more gentler approach, perhaps our patients would do even better. And even though this is a slide specifically on curcumin, I'm going to tell you too, there's another product or substance I use called delta tocopherols that has the exact same mechanism of action. It just says right here, instead of saying curcumin, it could say tocotrienols, and it has the same effect on the tumor cells as curcumin. So we use a lot of that too. So curcumin's been used, there's a lot of evidence, there's over 2,000 studies, I believe, that's either underway or have already been published on the use of curcumin worldwide. But as you can see, there's various cancers to consider, different lymphomas, leukemias, bone cancer, gynecologic cancer, breast, brain cancers, etc. GI cancers, lung cancers, etc. So there's a lot there. Now, so it's getting a little late, so I'll try to tell you, what do we do here? So, once again, we emphasize the point that cancer is a systemic disease. It's a wound that doesn't heal well, and we have to address the whole person. So these are some of the biological type of things that we address. I've mentioned every one of these to some degree already. I didn't talk much about balancing energy, by the way. But I didn't talk about oxidation, something called oxygenation. I did mention hyperbaric oxygen. But anyhow, so these are various things that we, as a whole, look at. So we're trying to improve the outcome by controlling inflammation, by improving mitochondrial function, by reducing blood clotting factors, abnormal blood clotting factors, by supporting oxygenation, supporting the mitochondria, and building and balancing the immune system, and looking at the whole body as a whole, looking at the infections, the heavy metals, the hormones of the body, all those things. It's best to balance them in order to have the best possible outcome for our patients. And we also, as I mentioned, we want to detoxify by removing eating toxic emotions, toxic food, different infections, something called persistent organic pollutants. Those are things like pesticides and herbicides and phthalates and parabens. Parabens are commonly found in soaps, shampoos, conditioners, cosmetics, toiletry products. I got dressed this morning, I was watching ABC News, and I happened to just had it on, and Good Morning America was on. And I saw one of the Kardashian sisters. It wasn't Kim, it wasn't Khloe, I don't know. Courtney, you got it. It was Courtney this morning. So I didn't get a chance to watch the whole thing because I was kind of leaving. Did you see it?
No, but
But she's on a crusade right now to have the FDA look at all the different topical toiletry and cosmetic products that are on the market, lipsticks and everything, because many of these things have so many chemicals and they haven't been assessed, they haven't been evaluated by the FDA for safety and especially for possible cancer issues. For years, people are, you apply it every single day, deodorant, soaps, conditioners, whatever, toothpaste, and we don't know the full impact of these agents on our body. We already saw how there's 287 different chemicals in cord blood that's been identified, of which 180 something were potentially carcinogenic. So where's it coming from? Well, from all the things that we're touching, eating, breathing, and all that kind of stuff. And we're wondering, why are we seeing cancer rates so high today? That's one area. There's two. But anyhow, so I'm hoping that there's an assessment, an analysis of the different substances out there, because you can try to find now some paraben-free products, some phthalate-free products. For years it was the chemicals and the dyes, and a lot of them were removed. Anyhow, there's various lab. Oh, I meant to take that one off. That one's no longer available. I took it off. So there's something called Oncoblat that's no longer available, but we're doing some other things about it. Anyhow, so we're doing various lab studies to best assess the body. There's something called nagalase that we sometimes measure that has to do with, if it's too high, it may actually disrupt the normal effect of the macrophages. Macrophages are a type of white cell that their job is to engulf and destroy foreign invaders, microbes, and cancer cells. If we have too much nagalase, those macrophages are suppressed. They don't work well. So anyhow, so we keep an eye on that because we don't want the nagalase level to get too high. This galectin-3, I have a couple slides on that. That's the one I said it causes great inflammation and metastasis. In some cases, we might run certain what's called chemotherapy sensitivity testing. It's a new area in science and in medicine. It is still, in my opinion, in its infancy. There's a few companies that run this kind of thing. It's called a liquid biopsy. They take blood, they send out to different labs, and they try to figure out are there have certain genes mutated, and if so, what might be the best agents, chemotherapy agents, or maybe even natural agents, to help against those genetic mutations. Caris is another lab that does certain tissue. You have to send the tissue in, and they look and they try to, once again, figure out where there are certain mutations, and therefore pinpoint medications, drugs, chemotherapies, even immunotherapies, against those particular mutations. And there's other labs too. There's something called Foundation One. There's various others. These aren't the only ones. We do a lot of immune testing, looking at something called the T and B cells, looking at the natural killer cells, looking at the inflammatory markers. There's something called cytokines. And we might look at things like viruses, bacteria, heavy metals, vitamins, minerals, antioxidant levels, and something called oxidative DNA damage. When DNA gets damaged, that makes us more prone also to cancer formation. So we got to minimize that DNA damage if we can. So we do some, the purpose of me showing this is some very unique lab studies that we do, and these are things that are not being done by the masses, by traditional. They just do. I talk to my patients all the time, of course, and I say, well, what kind of tests does your doctor do to see how you're doing? He says, they do a blood count. Well, and they do a CBC and a CMP, which is a comprehensive metabolic profile. That basically looks at your kidney function, your liver function, your electrolytes, your proteins, things like that, and your sugar. The problem with that, if that's your only test, those do not pick up early stages of imbalances or early stages of disease. They only pick up late stages. You'd have to have significant, for example, liver inflammation in order for those to be abnormal. But there's other earlier warning signs that are so much more important that aren't going to be picked up by a comprehensive CMP, metabolic profile. And so we try to look for earlier warning signs of disease rather than waiting till the disease is already there. You're not, it's like the CBC, what's it going to find? Well, it's going to say if you're anemic or not. Well, before you're anemic, you're on your way to anemia. Maybe there's ways of figuring that out before you're actually there, before you're diagnosed with the disease. Traditional medicine tends to be very reactive. We try to be a bit more proactive, right? So it's a very different mindset. Anyhow, this is just this thing called galectin-3 I mentioned. It's something I said it can contribute to inflammation and metastasis. If it's too high, it's not good. It can inhibit apoptosis, and it can stimulate migration of the cancer cells from one area to another. And it can stimulate angiogenesis, which once again means excessive blood supply to the tumor. So it's not good. So we want to keep the galectin-3 low, and we want to, the best way that we know so far to do it is with the use of this modified citrus pectin, which is called Pectisol C. Let's go computer. I don't know. It's pretty good up till now. Hey, Kyle. Yeah. Can you figure out why this is not advancing?
Stress level just went up.
Right. Right. Let me do this. Let's open up. There's only about a few more stuff. Let's open up for some questions. I don't know why some advanced a few more, and I don't know why it just. Yeah. So, what questions might you have? Yes.
We citizens used to have the protection of a law called the Delaney Amendment, which, if any food or substance was positively known to cause cancer, it could not be put on the market. Lo and behold, under one of our presidents, the Delaney Amendment was taken away from us. This really pisses me off. Okay.
Don't get too upset.
Here's the question.
Don't ruin your immune system.
Here's the question. At least 10 years ago, talcum powder was
Yeah.
known to be cancer causing. Just
Yes.
coming out in the news now.
Right. Well, we've known it for years.
Here's my question.
Yeah.
I have a great granddaughter on the way, and I want to know a safe substitute for that rotten, cancer-causing talcum powder.
Cornstarch.
Organic.
Organic.
Not genetically
Not
modified.
genetically modified cornstarch.
Thank
There
you.
you go. Yes, let's make these quick. It's getting
My
anxious.
question is, if you haven't got a diagnosis of cancer,
Yes.
are any of those modalities that you're using there okay to use? Like, for example, especially like the heavy metals, do you testing on
Yeah.
people who do not have a diagnosis as yet?
All the time. So the question was, in case you didn't hear, do we test people for heavy metals who don't have cancer? And the answer is yes, we do that routinely. Because even things like diabetes, hypertension, has been associated with higher levels of these metals. Kids with learning disabilities, there's a higher risk of heavy metals in the body. All kinds of things that these can do to us that aren't good. Even autoimmune diseases have been shown to be associated with higher metals in our body. So yeah, we check them frequently in non-cancerous patients. Yes,
You said that chemotherapy doesn't kill.
cancer stem cells. Doesn't kill cancer stem cells.
What does?
Well, okay, so henopial is one thing that might. Metformin is another one that might. Something called sulforaphane might. Curcumin might. Omega-3 fatty acids might. So that's at least 5 right there. There's others as well, but those are 5 of them that might help. Yes.
I have non-Hodgkin's lymphoma in my eye. They've been keeping an eye on it for 2 years down at Wills Eye Institute.
Right.
My immune system, the IgG and IgA are down to nothing. My IgM's up around 900. Can that somehow be boosted naturally? I mean, I've been doing an all-natural diet, and they're keeping an eye on this. It's actually shrunk since I've been doing all-natural remedies.
Good.
But my immune system still remains
Yeah.
suppressed. Is it possible somehow to boost the immune system once it's down that low?
Generally, yes, but it takes a lot of work, energy, time. That's kind of what this thing says here too. But there are special agents that we sometimes use to try to boost the immune system. So there's medicinal mushrooms, which I breezed over quickly. There's even intravenous vitamin C has been helpful in a lot of patients. There are different what's called transfer factors that we use in our practice. There's other biological agents that we use because we do measure immune function and we see improvements over time.
Liposomal vitamin C, would that?
With what kind of
Liposomal?
liposomal? So a lot of people take liposomal vitamin C and they, it is not as effective. It's fine to take it.
Right.
It is not as effective as intravenous. Your level has to get up. We actually measure vitamin C levels here. So it has to be at least 300 to 350 or maybe 400 micrograms per deciliter in the blood in order to have an anti-tumor-like effect to it. You can only get that level with intravenous forms of vitamin C. The oral forms will not allow the level, it just won't go up that high at all. So we wish it would.
Okay.
Next question. You had one.
Me?
Yes.
Can you mix them, the ingredients that you were saying that would help with the stem cells, the destruction of the stem cells? Can you mix them? Can you use
Do you
more than
mix the
one?
different agents that I just mentioned?
Mhm.
Yes, you can.
Okay.
But you should do it under the direction of a physician who's knowledgeable, which may be hard
You
to find.
saved my life in 2008, so I bear
Oh.
from that.
Well, that's good to hear.
There you go.
All right, so those are the years. She just said I saved her life in 2008, so she figured she'd come back again. So we'll try again. That's what I can
No, I'm
say.
coming here for my mom this time
That's
because
even
I've been
better.
cancer-free the whole time.
She's been cancer-free today. Good. She's been cancer-free since 2008. Great. Congratulations. You must have done a lot of work. Because listen, this is a joint effort. I don't do anything. I just give you guys education and some know-how and the tools. But you guys have to work with those tools as
It was a
well.
lot of work.
It was a lot of work, and it is.
It took me 6 months of taking care of nobody but me.
Yes, this becomes your new job. So I have people say, "Oh, I can't do this and that. It's too much work. I have to work. I work at down the street at the store down there," and I try to explain to my patients, "Listen, this is serious.
Yep, I
You're
took
not gonna be
6
able to
months
work.
off work and I did nothing but take care of me and come here.
You took 6 months off from work and did nothing but come here." Okay, in
I had
2008.
stage 4 kidney cancer. They got hold of my family, convinced them I was suicidal because I wasn't taking the kidney out. When they took it, they told me they took a perfectly healthy kidney. After being here from July of 2008 to, I think I stayed here till June 2009, and they took it in July. Oh yeah, I stayed right up to because we got this vitamin C as high as we could possibly get it. They took the kidney July 17th and said, "We are so sorry." And then they told me 2 weeks later that I had to go on a kidney transplant list because the other kidney's damaged, and they couldn't tell me that ahead of time. So I've been on a transplant list since 2009.
It's a remarkable story.
But I couldn't, and I say to people all the time, the one thing I learned with Dr. Magaziner is I had other people that were trying it on their own. I succeeded because I had him, and I also deal with Mike Adams. I was dealing with Mike Adams at the time. And between those two guys and Ty Bollinger, between all three of them and all the information they were giving me, I was able to do it. You can't do it by yourself.
Yeah,
It's
it's hard. I mean,
impossible.
you know that back there. It's very, very difficult. You need a coach. You need people to work with you, and not just one. You may need a whole team to work with you.
Well, I came in with the fertilizer poisoning, remember?
Oh yeah, now I do.
So we went to Mike Adams because Mike Adams understood the heavy metal portion of it.
Mm-hmm.
So he was telling me he had products that were heavy metal free, so I knew I could buy stuff that was heavy metal free. And then I was working with you, and then I got hooked up with Ty Bollinger,
Sure.
and the whole circle. But it took all of us to do it.
Right. It takes a village, they say, right? It's an expression. You take a. Yeah, that's it. Marie, you have a question?
Yeah, if someone wants to do early prevention, right? Like
Yes.
you want to give advice to family, because they're asking it too.
Sure.
Besides doing that CBC and the CMC blood work
Yes.
and that collecting, you emphasized that was important. Is that
Right.
something they can request to, or what else can they ask for?
Well,
in
those
their
are
blood
some of
work?
the important things. But someone should discuss what their lifestyle, their dietary habits, their exercise, their mindset.
Okay.
So that's a big part of it. They can also have. We'll often check what's called D-dimer. We'll often check the nagalase level. We'll check the nutrient levels on the body, because if you're we'll check coenzyme Q10 and what's called glutathione, which is a strong intracellular antioxidant. If you're deficient in these things, your body's not going to fight as well. And whoever asked me earlier about how to increase the immune system, you did. Those are some of the things that we would key into. So, anything we do to optimize cellular function is going to be very, very important.
One more
Yes.
thing, if or since biopsies can spread the
Mhm.
tumor, how can you get a diagnosis safely without a biopsy?
Okay, so I'm not saying don't have a biopsy, but take an anti-inflammatory around the time, before it, and during, the next day perhaps.
So you still get it, but you do the anti-inflammatory.
Yes. If you have to get a biopsy, make sure you're taking anti-inflammatory along with it. So even
You're talking about
aspirin.
curcumin, right?
Well, curcumin's one. In the study, they use ketorolac, which is a traditional medication. But there's boswellia, which is an anti-inflammatory.
What
Things
is
like that.
boswellia?
It's a Indian Ayurvedic herb that has anti-inflammatory
Like
love
from
effects.
frankincense.
From frankincense, thanks. Yeah. By the way, thank you for sharing your story. That was very powerful for everyone to hear.
No, you saved my life. I dropped 53 pounds in less than 30 days, and I went to every emergency room, and the only person that would help me is you.
Thank you for sharing that too. That's very sweet of you. Any other questions? Yes.
Yeah, can I just make a point here?
Of course.
I'm happy to be here. I'm down from Monmouth County, and I know there's some good things going on here. I have a health care practice in Monmouth County, and we currently have some mutual patients. And the common theme that I hear is, I've never felt better. And I don't attribute all that to you, because we're mutually treating these people.
Sure.
But
It's fine. That's what I'm saying. We're a team. This isn't a,
it's really great. So I decided to come down here
Thank you.
and just see a little bit more about what's going on.
Right.
And I'm excited
Yeah.
about this.
No, he's right. I mean, we have so many people that say, I never felt better than, I felt great. And I'm, it's not like we cure everybody, we don't. But the people have quality of lives. They can go on and do things. They can enjoy themselves. They can go on vacation, go to movies, out to dinner. They can enjoy their grandchildren. So, we need that. That is so crucial. It's not about how long you live. It's also what quality of life do you have while we're here. So, we have to, and we often, as you said, work as a team. And we need input from everybody, because there's no human being in the world that knows everything. And so we have to use other people's energies, positive energies. That energy itself is so important. So don't, and go to your regular doctor, get opinions, that's fine. But use your own intuition sometimes, your own education, your own research. Don't neglect that part. You have to play an important role in your healthcare as well. All right? So thanks so much for attending tonight. Appreciate you all coming. You can turn it off.